Brian Denton is here from the University of Michigan, and he's also Inform Secretary. Thanks for joining us.
Thank you.
Now, you worked at the Mayo Clinic really at the intersection of healthcare and analytics. How are those two connected?
Yeah, well, I think a lot of people don't realize how much analytics gets used in healthcare these days. So healthcare is an industry that's a major user of analytics and has been for decades. They use statistical models, simulation, Markov chains, decision analysis, a whole range of different analytics tools to answer questions about how best to treat patients, how to lower cost and operations, and a wide range of things.
All right, now what kinds of decisions can analytics help make in that field, whether it's a doctor or a person running the hospital?
Yeah, so they span from the patient right down to the patient level, all the way up to senior administrators. So people, there are probably 200 talks going on at the annual meeting here, and people are working on things like how to improve healthcare delivery in surgical settings, so how to make surgery planning and scheduling more efficient, lower cost, and more accessible to patients. A whole range of people are working on the opposite end of the spectrum, like how to design treatment schedules and how to decide whether a patient should have a biomarker test to try to detect cancer early, for example. So it spans sort of clinical all the way to operational kinds of decisions.
Yeah, and that's kind of connected here. How can analytics help in the detection and treatment of diseases?
Yeah, well, that's a great question. So there are hundreds of diseases, many of which people have started to develop new biomarkers for early detection. But a lot of what doesn't happen until much later in the game is understanding how you would actually use those biomarkers in a healthcare setting when trying to decide with a patient whether or not, to use the biomarker. And they can be expensive. They have high false positive and false negative rates sometimes.